Hi, welcome to It Takes Guts. I'm your host, Stacy. This is a shout out to happy fall because I'm excited for cooler weather. I've been a GI nurse practitioner for the past 6 years. Prior to that, I was a nurse in the endoscopy department for 15 years. I love GI. Today, we are talking about eosinophilic esophagitis, or EoE. This is something that we will diagnose when people come into our practice saying they are having trouble swallowing. We see adults in my practice. In pediatrics, they have a few different symptoms as their primary symptoms, so we're focusing mainly on adult. My husband allowed me, he said I had permission to use him as an example. He actually was diagnosed with this when he was in his 30s. His symptoms are classic. It started for him kind of, every once in a while he'd be like, oh yeah, I feel like something kind of got stuck in my throat when I was eating, not in my airway, but in my throat. And then it started progressing. We noticed when it was barbecue based or acidic based, he would have a lot of issues where he'd feel it kind of get hung up. So he would take a breath, get up, walk around for a little bit, drink some water. It would go down. He could finish his meal. It started progressing over the next few years where it became more frequent and then more severe, where one time we were at a restaurant and a piece of steak got hung up in his esophagus. And it wouldn't go down no matter what he did. He drank a sip of water and the water actually came back up along with the piece of steak, which was wonderful because it was able to get it out. But still, it was upsetting because he had to throw up a piece of steak at a restaurant. And it's scary when you can't get your food down. So that is the typical symptom that we will see with EoE is I'm getting food stuck in my esophagus. And it is becoming more progressive. Normally, we're going to see this in the male population. We still have females, but it is more male predominant. And usually we're going to start seeing it diagnosed in the 20 to 30s bracket. So how do we diagnose this? This is done during an upper endoscopy where we knock you out, you're asleep, and we take a little scope with a light on the end and we pass it from the mouth down the esophagus. Now, looking at the esophagus, if it's severe enough, we can actually see some changes with this where there may be some ring-like appearances to the esophagus or even little furrows. They call this feline esophagus. So when we biopsy the esophagus, that is where we see eosinophils, and there will be a number of them in the microscope. They'll be able to see them on the slide. So eosinophils are a type of white blood cell. They're seen with allergic responses, and when they show up in the esophageal mucosa, it can cause an esophagitis or an inflammation, a microscopic inflammation that causes symptoms of food getting stuck in the esophagus. It is some type of allergic reaction, most likely of food that you are consuming, but it can be very difficult to identify what the trigger is. Frequently, if we have somebody come in, they're having trouble swallowing, you want to make sure it's not a stricture or a narrowing in the esophagus. You certainly want to make sure it's not a tumor or a mass. You want to do the upper endoscopy. And that's how we're going to biopsy it, because you won't necessarily see stricturing. You just see some of the changes, or it might even look completely normal, except on the biopsies that we take. And then we can see the eosinophils. That's really how we're diagnosing it, is during the upper endoscopy. Treatment for this would be definitely getting somebody to see an allergist, because I'd say I think the studies are saying about 20 to 30% on the high side of patients who have eosinophilic esophagitis also have some significant other allergic responses to either environmental allergies, other types of food allergies they know about, asthma, something like that. So you want to see an allergist to find out, are there some things that you are clearly being exposed to that may be causing these eosinophils to get into the esophageal mucosa? We do not normally start somebody on a strict diet when we see them, because I don't really know what their trigger is. And to try to put somebody on a strict elemental diet can be miserable and might not necessarily be helpful. The thing that we start with is treating somebody's reflux. People might not even think they have reflux, but it is seen with reflux. And if we can reduce the acid in the esophagus, that's the first line. We actually see a response. We'll give somebody just a standard dose of Nexium or Prilosec or Protonix, and we'll reevaluate them in about 4 to 8 weeks. And I would say a majority of patients feel like they are able to swallow a lot better. If it's not feeling better within 4 weeks, we may try to double the dose. We don't like to keep you on a high dose. We would keep you on that for 4 to 8 weeks. See if your swallowing's better, then try to get you down to the lowest effective dose. Some people don't respond to this at all. And so there's some other medications that we can use. One of them is budesonide. That's a type of steroid, not quite like prednisone, but similar. And what this is doing is it's decreasing the inflammation or that inflammatory response that's going on here. And people do have a pretty decent response to that also. Budesonide is sometimes hard to mix up. It comes in little granules or a respule, so you might have to put it in, they'll say like mix it with some water and some Splenda or a little applesauce. You can also use an inhaler form where instead of inhaling it like you would if you have asthma, you actually swallow it. And that is actually what my husband was treated with along with some Prilosec, and he did fabulous and actually hasn't had any issues since. If you are still having difficulties even after the medications, you've seen an allergist, then that would be something that maybe we would have to send you out to a larger center, such as one of the university centers for treatment. Some people wonder, well, can't you just stretch the esophagus open and that'll make it feel better? We really don't like necessarily to stretch open the esophagus or use a dilator in people with this disorder because they could be at a higher risk of a tear in the esophagus afterward. So we really want to be careful. If we don't see a stricture or a narrowing in there, then we're going to definitely biopsy for the eosinophils and then treat it. So when would you need to see somebody? If you are having any issues with feeling like food is getting hung up in the esophagus, you want to go talk to your GI provider, your primary care, and get the ball rolling. You want to get a diagnosis. You don't want to be misdiagnosed. You don't want to be trying to treat this at home by yourself. So please, if you feel like you're having any issues, please contact your primary care provider, contact your GI provider. We definitely want to get you feeling better. And as always, please like and subscribe to the channel. Leave me some comments if there are some other things you would like to hear about or some more details on some other videos we've done. Let me know. And remember, I want you to be informed, educated, and know that you are not alone. Thank you. Yeah, I think that was pretty straightforward. Do you want me to pause this now before I do my short?
Yeah.